So is there a diet for SIBO, a dietary treatment that will help SIBO or cure SIBO? Some people think with diet you can cure SIBO. Tell us a little bit more about diet.
Yeah, diet. Well, diet is really important. I would say it doesn't cure SIBO. I don't usually see a special diet actually eradicating the bacteria, unfortunately. And studies show that diet in and of itself doesn't usually eradicate the bacteria, but it does help with symptom relief a lot. So it is extremely important for symptom relief and for patients to at least be much, much more comfortable while we treat the SIBO and while we use the other treatment options to eradicate the SIBO. The bacteria, I think I mentioned before, likes carbohydrates. And so the diets that tend to help manage symptoms limit or restrict carbohydrates to at least some extent. And some patients actually need to restrict or limit carbohydrates to a much, much greater extent for symptom relief. So sometimes it depends on the patient how strict we get. But there are a few diets that I use that have been developed specifically for SIBO. Some practitioners have done a great job at developing diets that can really help relieve symptoms. Dr. Alison Seebecker, she actually mixed the low FODMAP diet, which was developed for IBS, and it restricts some of the fermentable carbohydrates. And then the specific carbohydrate diet also restricts some of the carbohydrates. But on their own, whether, if you just use the low FODMAP or if you just use SCD, sometimes it wasn't enough limitation of the carbs to help symptoms enough. So she basically put those two together. It's quite restrictive and limiting, but I do let patients know this might make you feel so much better in the meantime.
Yeah.
And it's not a long-term diet, right? It's just a therapeutic diet. We don't want you on this diet long-term. So it's usually short-term. And there are a few other diets that are developed. Dr. Pimentel, he's a world-renowned SIBO expert out of Cedars-Sinai in LA, and he has a low fermentation diet. It's not as restrictive, and some patients can get enough symptom relief from that diet.
Yeah, and there's also the diet, a spin-off of the Alison Seebecker, the biphasic diet, created by Dr. Niraj Jacobi. And she even has a histamine biphasic diet, right? That sometimes is helpful for those mast cell cases.
Yes, you're so right. And I'm actually not that familiar with her histamine specific diet, but her biphasic diet is similar in limiting carbohydrates to Dr. Seebecker's. But a little bonus in there is that she does it in a stepwise fashion in order to avoid die-off symptoms and other uncomfortable symptoms that could happen if you just restrict and then add food back in right away as well. So she takes that into account.